Dr. Hans Hartung is a consultant respiratory physician and provides a service for patients with chest conditions, including looking after people with asbestos-related lung disease. There are several widely recognized asbestos-related conditions. Dr. Hartung will explain the difference between these conditions.
Pleural plaques are areas of hardening or thickening or scarring of the lining of the lung, which is called the pleura. They do not cause any major symptoms to patients. They just tell us that this person has been exposed to asbestos at some stage in their life. Now, diffuse pleural thickening is a similar process as to pleural plaques. It is just a much more widespread process that again involves that membrane called the pleura and can lead to breathlessness in the individual case. Part of that process of pleural thickening can be that the lung becomes enfolded and it sort of gives a rounded appearance, more likely seen on a CT scan rather than a chest X-ray, and you call that rounded atelectasis.
Asbestosis is a delayed reaction by the lung to inhaled asbestos fibers, which leads to fibrosis or scarring of the lungs, which is usually relentlessly progressive. It can appear in various parts or quite often throughout the lungs. Unfortunately, there is no specific treatment available, and as I said, the disease in most cases progresses, sometimes gradually and sometimes in a more accelerated form.
Statistically, exposure to asbestos does increase your risk for developing lung cancer at a later stage in life. The risk becomes even higher if the person has been or is still a smoker. Malignant mesothelioma is a malignant tumor that is linked to previous asbestos exposure. It is a tumor that again grows along the lining of the lung, the pleura, and progresses along this area. And it is a malignant tumor, so it has a significant effect on the patient's lifespan as well as general health. It can also appear sometimes inside the lining of the tummy, called the peritoneum. We have to be aware that all of these conditions we talked about are chronic conditions. They are with the person for the rest of their life, and it's going to affect their life in some instances more than others. So I personally have a very great interest in self-management support, as I'm involved in another project in that matter. And we doctors traditionally were taught to fix problems for patients. But times have changed, and we realized that that model is not working very well for patients with a chronic condition in particular. So we are very keen to move towards a collaborative or a partnership approach that shares decision-making, that involves patients in the care of the chronic and lifelong condition. And what we like to promote is a set of tools, techniques, how to improve skills, and how to change the culture towards a collaborative partnership working between clinicians and patients. It is building confidence in patients with a chronic condition. It is enhancing their skills to manage their own condition in their daily life. And it is to produce a proactive interaction between clinicians and service users. So a lot of benefit from that approach in terms of better health-related outcomes and patient satisfaction.